Let me begin the presentation. Let me begin the presentation. The main point of our presentation today is that with the integration of ultrasound and a collaborative team approach, we've made treating severe lymphedema achievable. The patient on the left is a woman in her 60s who underwent surgery for uterine cancer. At the other hospital, she underwent lymphaticovenular anastomosis LVA and lymph node transplantation, but her symptoms did not improve, so she came to our clinic. This is our conventional treatment explanation. About 7% of patients show improvement after surgery. Approximately 50% of patients improve after treatment. 25% of patients show no change. And most importantly, about 25% of patients experience worsening symptoms even after undergoing the surgery repeatedly. Upon closely examining the breakdown of these worsening cases, we identified two main issues. Firstly, inadequate adherence to conservative therapy. Secondly, some patients continue to gain weight. We cannot simply ignore cases where postoperative symptoms worsen. Thus, we decided to introduce ultrasound and implement team-based healthcare, understanding that we cannot leave such cases unattended. For plastic surgeons, ultrasound may not be familiar to everyone. In that regard, I've compiled a slide summarizing the history of ultrasound for 1 minute, which I would like to share with you. First, let me introduce the ultrasound art created by Yoichi Okiai. Applying ultrasound from multiple directions causes objects to float and move in their shape. Even lightweight objects can be levitated in this way. History of ultrasound research. In the 1700s, it was discovered in bats. Considered wisdom for safe flight. Research accelerated due to the sinking of the Titanic. In 1912, ultrasound technology could have detected the presence of icebergs. Subsequent research accelerated further through World War I and World War II. This was because the development of technology to find submarines underwater was necessary. After the war, this technology began to be used as a fish finder. With the advancement of ultrasound technology, it has become possible to analyze individual fish instead of just the size of fish schools. This ultrasound technology was applied to medicine by a neurosurgeon in 1942 to detect brain tumors. About 10 years later, it was used to monitor pregnancy and childbirth. In the 1960s, Doppler technology was introduced, making ultrasound images of the heart and blood vessels clearer. The identification of lymphatic vessels began 200 years later, with the discovery of collecting lymphatic vessels by Dr. Hayashi and colleagues in 2015. In 2018, we announced the ability to qualitatively evaluate these collecting lymphatic vessels using ultrasound. This illustrates the difficulty of performing LVA in severe cases. As they deviate significantly from normal, lymphatic vessels or veins become difficult to find due to their abnormal morphology and considerable distance from their normal positions. Furthermore, as fibrosis progresses, it becomes very challenging to locate very delicate and thin structures such as lymphatic vessels and veins. When performing lymphoscintigraphy or CT scans, abnormal expansion or mutation of lymphatic vessels may be observed, or only dermal backflow patterns without linear patterns can be detected. Therefore, we use ultrasound to identify the position of collecting lymphatic vessels in severe cases. The image on the right shows veins and lymphatic vessels. In the upper left image, which is of the patient we discussed earlier, there is 12.7 centimeters of subcutaneous tissue. However, surprisingly, collecting lymphatic vessels are found at a depth of only 1 to 1.5 centimeters. In this sense, ultrasound with a frequency of 12 to 18 MHz is effective. Searching various areas reveals images like these. Let me show you in a video. This is the finding of the contracting collecting lymphatic vessels in the inner calf. We can see that this patient has functioning lymphatic vessels. This is the collecting lymphatic vessels in the outer calf, where we can observe the fluttering of valves within the collecting lymphatic vessels. It looks very clear. By using ultrasound technology in this way, we accurately identify the positions of veins and lymphatic vessels preoperatively. As a result, surgery under local anesthesia can be performed in 30 to 40 minutes per location. We are undertaking new initiatives. Looking ahead, we are considering whether it might be possible to rely solely on ultrasound for preoperative evaluation, discontinuing painful examinations such as lymphoscintigraphy or ICG lymphography. In lower limb lymphedema, by conducting qualitative assessments of collecting lymphatic vessels with 3 lymphosomes, we have grasped the ability to accurately identify locations. Today, I would also like to talk about team building. This ultrasound technology is legally applicable to various professionals such as medical assistants, nurses, physical therapists, occupational therapists, and massage therapists, and allows them to perform procedures. By accurately understanding the state of edema, we can now discuss with surgeons whether it's time for conservative therapy or surgical intervention from the same perspective. Postoperative progress. Even patients with severe lower limb lymphedema can recover to a moderate degree through conservative therapy at their initial visit. Furthermore, performing LVA surgery enables further reconstruction of lymphatic pathways, leading to progressive symptom improvement. What we are currently placing great importance on is the ability to walk beautifully and healthily. By introducing the latest rehabilitation techniques and focusing on analyzing patients walking, we aim for superior restoration of walking function. Especially useful is the smartphone app accelerometer sensor for detailed analysis. In summary, when presenting our conventional postoperative outcomes, we found that 25% of patients continue to deteriorate after surgery. However, by implementing appropriate conservative therapy and weight control, we have been able to reduce the postoperative deterioration rate to 4.2%. This reduction is attributed to advancements in surgical techniques and the formation of medical teams, allowing for comprehensive symptom improvement. In discussing the art and science of lymphedema treatment, we believe that the introduction of ultrasound and the practice of team-based healthcare are crucial.